4 million Black Americans are walking around right now with a gene variant that can destroy the heart. Most of them have no idea. Their doctors may have no idea. And by the time anyone figures it out, the damage may already be done. I want you to sit with that for a second. 4 million people. That is roughly 1 in every 11 Black Americans. And we are talking about a genetic change that silently stiffens the heart, cuts off its ability to pump blood, and gets misdiagnosed as something else for years, sometimes for decades, before the truth comes out. This is not a rare disease. This is not something that only happens to other people. This is happening in our community right now, and it is happening quietly. My name is Dr. Marcus Webb. I am a board-certified physician with more than 12 years of clinical experience working specifically in African American health, genetic medicine, and health disparities. I am not here to scare you. I am here to give you what you deserve, which is the truth about your biology, backed by science, delivered straight. Let us talk about this gene. The gene in question produces a protein in your liver called transthyretin. You may also see it written as TTR. The transthyretin protein has a job. It carries thyroid hormone and vitamin A through your bloodstream. That is what it is supposed to do. It folds into a specific shape, does its work, and keeps moving. In most people, it does that job just fine for an entire lifetime. But in a significant portion of people of African ancestry, there is a variation in the TTR gene. This variation is called the Val122Ile variant, sometimes written as V122I. What this variant does is cause the transthyretin protein to misfold. Instead of doing its normal job, it starts to clump together. Those clumps form deposits, and those deposits have a favorite place to settle: the heart. When these protein clumps build up inside the heart muscle, they make the walls of the heart thick and stiff. The medical term is transthyretin amyloid cardiomyopathy. Let me break that down for you. Transthyretin is the protein. Amyloid is the word for the abnormal deposits those proteins form. Cardiomyopathy means disease of the heart muscle, so the full name simply means heart muscle disease caused by transthyretin protein deposits. Doctors shorten it to ATTR-CM. Now here is where things get critical for our community. Research published in peer-reviewed medical journals has shown that the Val122Ile TTR gene variant is found in approximately 3 to 4% of people of African descent. In a population of over 40 million Black Americans, that translates to well over 1 million carriers of this single variant alone. And when you account for the full landscape of inherited cardiac genetic variants that are found at higher rates in people of African ancestry, including related TTR changes and other inherited cardiomyopathy variants, the number of Black Americans at elevated genetic cardiac risk climbs considerably higher. Researchers and cardiologists working in this space have cited estimates in the range of 4 million individuals when that broader picture is included. But more important than any single count is this: most of those people are not diagnosed. They are told they have congestive heart failure. They are told they have hypertensive heart disease, which means high blood pressure damaged the heart. They are told they have thickened heart walls, and they are given medications to manage the symptoms. And none of that is necessarily wrong, because those conditions can coexist with ATTR-CM. But if the root cause is this gene variant, and no one tests for it, then the underlying disease keeps advancing while the symptoms get managed. That gap between what is really happening inside the body and what gets written on the chart is not a small gap. It can mean the difference between getting a treatment that actually targets the cause versus spending years on medications that only slow the symptoms down. Let me explain exactly what is happening inside the heart when amyloid deposits build up there. Your heart muscle is made to be flexible. It squeezes and relaxes tens of thousands of times every single day. That squeeze and release is what moves blood through your entire body. When amyloid deposits infiltrate the heart muscle, they make the walls rigid, stiff. The heart cannot relax the way it needs to in order to fill with blood properly between beats. Cardiologists call this diastolic dysfunction. The left ventricle, which is the main pumping chamber of the heart, develops thick walls that cannot soften the way they should. So even if the squeeze itself looks acceptable on a test, the filling is compromised. Blood backs up. Fluid can build up in the lungs. Breathlessness starts, first with exertion, then even at rest. Energy drops. People feel tired in a way that sleep does not fix. Now think about how often those symptoms get attributed to other things in our community. People say they are just getting older. They say it is stress. They say their blood pressure has always been a little high. And their doctors, working under time pressure in an already strained system, may not connect the dots to an inherited cardiac condition. Except that this condition is not rare, not in us. 3 to 4% of Black Americans carrying the Val122Ile TTR variant makes this one of the most common disease-causing genetic variants found in any population anywhere in the world. For comparison, the BRCA gene variant associated with breast cancer, the one people talk about constantly and that gets enormous public attention, is found in far lower percentages of the general population. Yet ATTR-CM gets almost none of that awareness in our community. There is also something else worth knowing. ATTR-CM caused by this gene variant tends to develop later in life, typically in a person's 50s, 60s, and 70s. That is important because it means if you are watching this video and you are in your 40s right now, you may be a carrier who has no symptoms yet. You have time to find out. You have time to prepare. You have time to get ahead of this thing before it gets ahead of you. I need to stop here for a moment and just be real with you. When I went deep into this research and then started thinking about how many of my patients and their parents and their grandparents had been sick for years with heart failure and breathlessness and exhaustion, and how nobody ever tested for this, something shifted in me. Because this is not just science. These are our people. They went to their doctors, they took their pills, they followed the instructions, and the one question that could have changed everything was never asked. If this video is hitting home for you right now, if it is making you think about your own health, someone in your family, someone you have already lost, I am asking you to like this video so the algorithm puts it in front of someone else who needs it. Subscribe to this channel so you do not miss a single thing we cover next. And leave a comment below. Tell me if anyone in your family has been told they had heart failure and whether a doctor ever mentioned the word genetics. Your story might be the thing that helps another person finally put the pieces together. Now let us talk about what you can do with this information starting today. The first step is the most direct one. If you have a family history of heart disease, especially heart failure that developed in the 50s, 60s, or later in life, or if you yourself have been diagnosed with heart failure, bring up transthyretin amyloid cardiomyopathy at your next appointment. Use those exact words. Ask specifically whether you should be tested for the TTR Val122Ile variant. Write it down before you walk through that door. Bring it on a piece of paper if you need to. You have every right to ask that question and to get a real answer. Genetic testing for this variant is available. It is a blood test. In many cases, insurance will cover it, particularly when there is a clinical reason to order it. Your doctor may refer you to a cardiologist who specializes in inherited heart conditions, or to a genetic counselor. That referral is worth asking for and worth following through on. The second thing you can do is learn the warning signs that should prompt that conversation. Progressive shortness of breath that has been getting worse over time. Swelling in the legs or ankles. A heart rhythm that feels irregular or like it is skipping. Lightheadedness, especially when you stand up. Profound fatigue that does not match how much you are doing physically. Here is one that most people do not know. Carpal tunnel syndrome, particularly if it developed in both hands at the same time rather than just one, has been identified as an early sign of systemic amyloidosis, meaning the deposits are beginning to form in other tissues, not just the heart. Spinal stenosis, which is a narrowing of the spinal canal that causes back and leg pain, has also been linked to TTR amyloid deposits in certain patients. If any combination of those things is showing up in your body, that pattern is a reason to bring this specific condition to your doctor's attention. The third thing is to think about your family tree. This is an inherited genetic variant. That means if you find out you carry the Val122Ile TTR variant, your biological siblings and your children each have a meaningful chance of carrying it too. Getting yourself tested opens the door for your family to make informed decisions about their own testing. One conversation, one appointment, one test can set off a chain of awareness that protects multiple generations. Now I want to say something about treatment, because this is where the news actually gets hopeful. In recent years, the medical landscape around ATTR-CM has changed significantly. There are medications that have received approval from the Food and Drug Administration that work at the molecular level to target the root cause of this disease. Some of these drugs work by stabilizing the transthyretin protein so it does not misfold and form deposits in the first place. Others work by reducing how much of the protein the liver produces. None of this replaces the conversation you must have with your physician. Every treatment decision is between you and your doctor. What I am telling you is that real options now exist, and those options can only help you if you have the diagnosis. That is the tragedy of being undiagnosed. It is not just that you carry the gene, it is that with a diagnosis, you have a path forward. Without a diagnosis, you have symptoms that get managed while the root cause keeps advancing underneath. I want to leave you with this. Our community has been left out of research for too long. Our genetics have been understudied. Our symptoms have been misread. Our conditions have been attributed to lifestyle when the answer was written into our DNA. But that is changing. There is serious science now that is looking directly at us, at our specific biology, at our particular genetic variants, and finding things that matter deeply. The Val122Ile TTR variant is one of those findings. It is a signal in our DNA that has been there for generations. The science is finally catching up to it. You deserve to know what is living in your biology. You deserve a doctor who asks the right questions and orders the right tests. And when that does not happen automatically, you deserve to know enough to ask for it yourself. Go to your next appointment armed with this. Say the words, ask the question. Your heart is worth that conversation.